Understanding the difference between MRI and CT scan. MRI, magnetic resonance imaging, and CT, computed tomography, scans are both imaging techniques used in medical diagnostics, but they operate on different principles and are used for different purposes. Here's an overview of how they differ. MRI uses magnetic fields and radio waves. An MRI uses strong magnetic fields and radio waves to create detailed images of organs and tissues inside the body. It is particularly effective for imaging soft tissues, such as the brain, muscles, and spinal cord. MRI does not involve radiation, making it a safer option for some patients. CT scan uses X-rays for imaging. A CT scan, also known as a CAT scan, uses X-rays to create detailed cross-sectional images of the body. The scanner rotates around the patient, taking multiple X-ray images from different angles, which are then combined by a computer to create detailed 3D images. It is commonly used to detect conditions in bones, organs, and blood vessels. MRI, better for soft tissue imaging. MRI is often preferred when detailed images of soft tissues are needed, such as in the brain, muscles, heart, or internal organs. It is commonly used to diagnose conditions like tumors, herniated discs, joint injuries, and neurological disorders. CT scan, better for bone and trauma imaging. CT scans are particularly effective at imaging bones and detecting traumatic injuries like fractures, internal bleeding, or severe bone conditions. It is often used in emergency situations to quickly assess injuries or detect conditions such as lung diseases and cancers. MRI, longer scan duration. MRI scans typically take longer to complete, often ranging from 20 to 60 minutes depending on the area being scanned. Patients need to remain still during the procedure to ensure high-quality images, and the process can be uncomfortable for those with claustrophobia due to the enclosed space of the MRI machine. CT scan, faster and more convenient. CT scans are much faster than MRIs, usually taking only a few minutes. This makes them ideal for emergency situations where quick diagnosis is necessary. They are also more widely available and generally more accessible than MRI machines in many medical settings. MRI, no radiation exposure. Unlike CT scans, MRIs do not use ionizing radiation, making them a safer option for repeated imaging, particularly in children or patients who require multiple scans over time. This makes MRIs the preferred choice for long-term monitoring in certain medical conditions. CT scan involves radiation exposure. CT scans use X-rays, which are a form of ionizing radiation. Although the amount of radiation is generally low, repeated exposure over time can increase the risk of cancer. This is an important consideration when choosing between MRI and CT scan for diagnostic purposes. MRI, higher resolution for detail. MRI generally provides higher resolution images for soft tissue detail, making it the gold standard for imaging the brain, spinal cord, and muscles. It can produce more detailed images than a CT scan, which is why it is often chosen for specific medical concerns. CT scan, more suitable for whole-body imaging. CT scans are better for whole-body imaging, especially for conditions affecting multiple organs or areas. They are often used for full-body scans to detect cancer, heart disease, and trauma-related injuries due to their speed and ability to capture comprehensive views of the body.